Welcome to the NMI podcast, and we're speaking with Professor Joe Firth or Joseph Firth. And Dr. Firth is Professor of Psychology and Mental Health at the University of Manchester in Manchester, the UK, and has a PhD in medicine from the University of Manchester as well. And the reason we're really speaking to him is because he's internationally recognized as one of the most highly cited scientists in digital medicine, lifestyle psychiatry, and mental health. He was awarded the USERN Laureate in Social Sciences in 2022 and named Research.com's #1 rising star in 2023. He's five-time recipient of Clarivate's Highly Cited Researcher Award from 2020 to 2024. He's published over 300 articles with more than 45,000 citations, a H-index of 90, including first author papers in top-tier journals, which you probably noticed, like the BMJ, Lancet Psychiatry, and so on. If you're in this field, whether you know it or not, you would have come across his publications. His current research leverages digital technologies and lifestyle medicine to improve outcomes for people with mental illness, and is currently leading a multi-million-dollar UKRI funded project around the implementation of digital lifestyle interventions to youth mental health care. Also leads the Lancet Commission on Physical Health and Mental Illness, acts as expert advisor for the WHO, World Health Organization's guidelines on physical activity and sedentary behavior, and engages extensively with traditional media, online media, and publications. So really high impact globally, and has been featured on, television like Sky News, BBC, and so on. So, I feel like it's a huge privilege to be able to speak to you, Joe, and really looking forward to this conversation.
Well, thanks for that very kind introduction. Yeah,
No,
hope I don't disappoint.
no, our pleasure. And I think when you go into the literature or get into this field at all and start looking at terms like lifestyle psychiatry and nutritional psychiatry, like these are firstly important themes in your work, but I also feel like that term psychiatry is like quite synonymous with your work. You've really been pushing that concept forward. So I guess before we get into the details in this discussion, like let's step it back a bit, and can you explain for listeners what lifestyle psychiatry is and what you mean by that?
Yeah, sure. So the idea behind lifestyle psychiatry, it's a term that was coined quite recently, in the last couple decades, and has become a lot more prevalent a lot more recently over the last decade. And the idea of lifestyle psychiatry is just basically bringing the principles of lifestyle medicine into all things mental health. So it's not limited to the practice of psychiatry or psychiatrists. It's very expansive in its scope, and it basically involves anything that is a lifestyle factor, such as exercise, nutrition, diet, sleep, substance abuse or smoking or things like that. All those what we consider like behavioral factors, and how they impact on the prevention and the treatment of mental health conditions, whatever that might be. In any context as well. So we can be talking like primary prevention. So how can we address lifestyle factors at the public health scale in order to reduce the incidence or improve recovery from mental illness, or provide more opportunities for people with mental illness to engage in lifestyle interventions, or at the secondary care or primary care levels, what can we actually do in mental health care services or primary care services that serve mental health patients? What can we do to address behavioral factors in ways that improve physical health and mental health in people living with mental illness?
Yeah, that makes sense. It's really well articulated, and it feels like there's a bit of a phase shift in that idea from looking at these things as risk factors for mental health to actually rolling into the realm of being treatments.
Yeah,
Yeah.
yeah, that's absolutely it. And really trying to make it actual part of mental health care as like a standard thing rather than just an additional kind of optional bolt on. So, how can these things be taken actually quite seriously in the context of mental health care is one of the main like focuses of our work at the moment, because that can be the hardest step and probably the biggest barrier towards the introduction of lifestyle medicine or nutritional medicine or whatever it might be into mental health care, is just how it's kind of siloed as a completely separate element of care and of treatment, when actually it could be, an effective compulsory component of mental health care that should be offered by all services. So that's not to say compulsory for the patients, not to be forced upon anybody, but certainly compulsory for the services to be able to provide evidence-based interventions in that lifestyle domain.
Yeah, no, that makes sense. And I guess on a personal level, I'd be curious to know what led you into this field. Like, you're deep in an unusual area that is relatively new in a sense. What led you to study this area of lifestyle medicine within psychiatry?
That's interesting. That might be a long story. I'll cut it very briefly. After finishing my first degree in psychology, I worked for a while with ex-offenders in like a rehabilitation project. And it was all young men living with mental illness who were ex-offenders coming out of prison. And the engagement that obviously there was a wide array of psychiatric and psychological interventions offered. One of the most popular things that you could see people benefiting from was physical exercise and exercise interventions. But this was before I actually really did any research. And I worked in a number of different roles where that seemed to be a common theme of the popularity combined with the lack of availability and complete lack of access and even restrictions around engaging in physical activity due to risk in that specific population. And then at the same time as that, there was a PhD advertised in early intervention for psychosis with Alison Young at the University of Manchester, which I then applied for to do something around exercise and bringing that into early intervention for young people with psychosis. And then that really started my career, which was all around for quite a long time, doing stuff around physical exercise for severe mental illness, particularly with regards to early intervention for severe mental illness, and working with a number of like the really best people from around the world who kicked that field off before I got into it, like Simon Rosenbaum and David Van Campfort and Brendan Stubbs and people like this who were, making huge strides in that field at the time. So that's kind of like a condensed way. It was all about the exercise and stuff. And then as you get into that, you realize that, and I was very much into fitness myself at the time as well. It was a big part of my life. So I really enjoyed like delivering those interventions and kind of like using that message as much as possible. But you see how other lifestyle factors fit into it as well, and particularly with regards to nutrition was always a big research interest of mine, much less of a personal interest, as you realize that the same people who are interested in or benefiting from exercise interventions quickly become interested in what can I do about my diet? How can I be eating better? How can I be healthier? And you again realize like the lack and the disconnect of things like nutrition, simple nutrition, not like complicated nutritional formulations or anything like that, just like basic nutritional advice and provision of basic nutritional interventions in mental health care, and how kind of separate and disparate it is. In fact, the opposite often, especially in inpatient units. So then I became more interested in how we can introduce nutritional factors into mental health care, combining it with the exercise and things like that. And then it just naturally spreads to the whole host of different lifestyle factors that can be affecting different individuals or that people might stand to benefit from. And it's just such a lively area of research as well at the moment in terms of like producing a number of promising findings, getting a great environment for actually gaining traction and impact in clinical services, which is obviously something I'm hugely interested in. So yeah, on the research levels and on the practical side of things, it's been a great time to be involved in a very promising field.
Yeah, that makes sense. And we're going to spend a bit of time talking about that focus on nutrition specifically. You've made several contributions to the field, and they're also very diverse, the areas that you've been involved in across this. So I'm just wondering, some of the themes you've looked at are things like the efficacy of dietary interventions, the efficacy of nutritional supplements, the mechanism of action of like biomarkers. I'm wondering if we can unpack some of that basically. And the place I wouldn't mind starting, which I know ties in with some of your early work on diet, was just looking at the potential of dietary changes within these mental illnesses like schizophrenia, major depressive disorder, bipolar disorder. Based on where we are now versus where you got into this, like what can we confidently say about the role of dietary interventions in these mental illnesses?
Yeah, certainly. Yeah, so the field of exercise has probably been more advanced in terms of like the underlying physiological factors through which you can drive changes in mental health through introducing something like exercise. And there's lots of studies, showing increases in things like BDNF, which is good for the brain, reductions in inflammatory processes in the body, and managing oxidative stress better from introducing people to physical activity or preventing large amounts of sedentary behavior. So we've seen that well with the exercise field already in the general population and more so in people with mental illness. And then with the diet stuff, it's kind of like a new emerging field that a lot of those same mechanisms, obviously through which you can impact mental health through exercise, might also apply to diet, especially with regards to inflammation. So we did really one of the first big studies to look at the actual inflammatory diets of people with mental illness using the UK Biobank back in probably 2019. So a really massive study. The UK Biobank's huge, hundreds of thousands of people and lots with various mental health conditions, major depression, bipolar disorder, schizophrenia. And those initial results showed pretty compellingly that not only do people with conditions like schizophrenia and major depression and bipolar disorder have what we consider a worse diet, higher calorie intakes driven by higher amounts of saturated fats and refined carbohydrates and sugars and things like that, but also high levels of what we consider like inflammatory potential of the diet and less anti-inflammatory nutrients in the diet as well. And that seems to be associated with those mental health conditions. So obviously, it can only ever be a bi-directional thing in terms of having a mental health condition will make it harder to maintain a healthy diet. But either way, it becomes something that's important to address, especially when you consider that one of the most life-threatening elements of any severe mental health condition now is not just the psychiatric side of things, but the physical health, the poor physical health that coincides with severe mental illness is probably the most life-threatening aspect of most mental health conditions and one of the biggest like gaps that we see in modern healthcare with people with severe mental illness dying 15 years younger than the general population due to things like cardiovascular and metabolic diseases, not so much due to suicide or accidents, which get a lot of the attention and are obviously terrible and deserve the attention they get in terms of trying to reduce those as much as possible, those preventable deaths in that form. But what doesn't get the attention and what isn't really addressed is the thing that accounts for about 85% of premature mortality in people with severe mental illness, which is the poor physical health. So it's like, let's start addressing this and let's start looking at what we can do from early on in treatment to ensure that people have at least access and at least a provision of the type of interventions that can address that physical health side, whilst we're also treating the mental health. And then the healthy body, healthy mind thing, it probably sounds obvious to a lot of the listeners about how obviously adopting a healthier lifestyle through things like exercise and through things like diet will confer benefits for someone's mental well-being as well as the physical well-being. And it almost sounds like boringly obvious to talk about, but in mental health care, it's just not really considered. That's not part of mental health care, that healthy body, healthy mind philosophy. There's certain champions and psychiatrists and psychologists who make sure it is part of their practice, and they're doing a great job, the ones who are doing it that way in the UK. And it's part of the guidelines in many ways, but in terms of like what's actually provided through mental health care, there's very little of that type of vibe. So
Yeah.
just often just turns into advice and vague advice that puts the onus on the patient to make behavioral changes without really any support. So we're like saying, let's look at where the evidence is for exercise and for diet, and let's implement that into mental health care.
Yeah. I mean, that's a great way of putting it is, my question was more around what is the efficacy of these kinds of interventions for improving outcomes specifically for mental illness. But the way you framed it is really stepping it back to the elephant in the room is that we've got a group of people that are at really high risk of diet-related diseases as a whole, let alone just their mental
Yeah.
health. And that is the elephant in the room. Like and not being addressed. We're still caught up on psychotherapy and pharmacotherapy and forgetting, this holistic, lifestyle medicine-based approach
Yeah.
that's equally important.
But then obviously, like your initial question was, not to overlook that there is, as we're doing more studies and the evidence is catching up to where we're at with exercise, the more studies that we do and the more RCTs that we get out there, there's more and more compelling evidence over time around the efficacy of actually using dietary interventions as an add-on approach to whatever other mental health care people might be receiving to improve, especially major depression now. There's really compelling evidence from a wide range of RCTs that Mediterranean diet interventions or things structured in that form, anti-inflammatory diets, as they might be termed in some respects, seem to confer significant advantages in mental health populations as well. But there's much less done in that field than people might imagine, compared to something like exercise or psychotherapy. And that's really, as a researcher, where it becomes very interesting because it becomes not only a ripe area for intervention, but a ripe area for scientific research to actually see, what type of magnitude of effect those has and how it fits in with the other lifestyle factors and things like that.
Yeah, it's almost tragic actually how recent this work is. Like I think Felice Jacka's SMILES trial was the
Yeah.
first randomized controlled trial in for the treatment of major depression, and that was pretty recent. That wasn't that long
Yeah, that
ago.
was pretty recent. And then even since then, that was probably getting on for about 10 years ago, I guess, since they completed the study and a little bit more recently since publishing it, which is very recent to say, we've been having drug trials and exercise trials in psychiatry for like a century. So yeah, it's super recent in that respect. And then even since then, there's probably only maybe a dozen now or something like that showing pretty similar results in the pretty similar dietary patterns for MDD. So it's very compelling evidence from what's emergent, but it's still massively under researched. And particularly with regards to the biological mechanisms that are driving those effects, there is some now showing it might be related to inflammatory processes, especially in those with high levels of inflammation. And there's, trials from, for instance, John Cryon's group. They're a really great group, APC Microbiome Ireland, doing some of the world leading research around the gut microbiome as an actual axis through which we can impact on diet in order to improve mental health. And that's producing really compelling findings as well. So that, there is emergent research that's just super exciting in this area, but it remains under researched compared to other types of interventions that are more widely used.
Yeah, absolutely. I'm going to ask you a few questions around nutritional supplements and how they fit into this wider context of lifestyle medicine and nutritional psychiatry. I know you've done a bit of work in this area, and I'm just, curious to hear your perspective around where these fit in lifestyle medicine and what their potential is for augmenting care and, in psychiatry.
Yeah, sure. So nutritional supplements are probably more researched, surprisingly, than just a healthy diet. And in some ways, they lend themselves better to empirical research because obviously there's that you can control better in a randomized controlled trial the placebo and the treatment, and people don't know what they're getting and things like that. So you can measure those outcomes a little bit more robustly. And again, there's, a whole host of evidence of good RCTs conducted in good sized samples showing efficacy of various different nutritional supplements in various different mental disorders. And we summarized all that at like the top tier for World Psychiatry, which is the official journal of the World Psychiatric Association, a few years ago now. And we've been in the process of updating some of those results as well. But again, really compelling evidence and very underused in certain elements. I think because it's obvious, well, not, perhaps not obviously, but in my opinion, you're never going to find one supplement that is, unanimously effective treatment for a specific diagnosis like depression or something like that, because it varies so much between individuals. And we seem to apply this higher, like, standard of evidence to things like nutritional supplements that might just get disregarded from even being considered in an intervention or kind of like put down because we'll say, well, that doesn't seem to work for everybody. But we don't even have any psychiatric drugs that work for everybody all the time. Most people who start an antidepressant end up on a different antidepressant because the first one might not be working, or then maybe the second one doesn't work. So it's like, but with nutritional supplements, it's like because it does require that individualized approach, and there's so many different ingredients out there with different claims and different evidence. I think they're just getting completely forgotten about and treated as though they require this high standard of infallibility in order to even be considered in treatment, which we don't have in psychiatry for anything. So it seems silly to disregard them. And the evidence there is worth considering, especially now as the research is developing and picking out some really core factors that might actually give us a way to predict individual treatment response. For instance, people with high levels of inflammation and depression respond better to omega-3 supplementation, probably because it's addressing that inflammatory axis that might be contributing to their depressed state. And there's other examples of that as well. People, for instance, with genetic deficits in how they might digest and absorb things like vitamin B12 or vitamin B9, methylfolate seem to be particularly responsive. There's a great study from Harvard showing how those individuals are particularly responsive to methylfolate supplementation, even with brain changes induced from methylfolate supplements in people with those genetic deficiencies in absorption. And we don't really know how prevalent those are in the population or specifically in people with mental illness. So it's it's a really progressing field, and it's a field that's been kind of overlooked due to different results from different trials and kind of forgotten about in some ways. But as we're getting better at targeting specific biomarkers and identifying which supplements might be most effective for which types of individuals beyond just a diagnostic category. It's something that's making quite a resurgence in that like biological psychiatry area and personalized psychiatry area. It's something with a great potential for further research there and fits well with dietary interventions as well, which is nice. And as much as, people might question the efficacy of some of these medications, nutritional supplements compared to the typically used medications, and it's fair to say that something like omega-3 might have less consistent evidence than the most popular antidepressant. I'm not sure how that would measure up if someone did it like for like. The two things I'd say is one, you never have to disregard other elements of people's treatment in order to introduce any type of lifestyle intervention or nutritional intervention often, because it's not a versus situation. It's like, what can we do to maximize an individual's chances of recovery? And then on top of that, the evidence for like the side effects of things like antidepressants is so much stronger than the evidence of any adverse effects that might be incurred from any nutritional supplements. So when you're counting on like a risk benefit basis, it's I don't think it's controversial to say that nutritional supplements incur considerably less risk in terms of nasty side effects, cardiometabolic and otherwise. So it's not to say one should replace the other, but it's like if we're taking medications that we currently have seriously as treatments, let's also look at other ways that we can improve people's chance of recovery, be it through whatever that individual wants to take on, exercise, nutritional supplementation, perhaps in a more personalized way that matches up with their conditions. Nutritional interventions, ideally, the dietary intervention, things like that. So yeah, I think there's a great lot of promise in that area. And it's interesting as well, how as soon as something definitely does seem to work and does gain like mainstream acceptance, it then gets forgotten about as a nutrient and becomes like a medicine as well. There's quite a common trend of that. And there'll be lots of people like on the NHS, for instance, having B12 in injections for things like fatigue or brain fog or whatever it might be, even maybe symptoms of depression, and they'll be receiving some type of nutritional based supplement or natural product, be it through an injection, again to bypass some like known potentially genetic deficit in absorption. When that potentially could be done through nutrient supplementation, it could potentially be done to reach more people. And not to say that it'd be the sole contributing factor of any mental health condition, that'd be quite rare. But to look at how we can actually take these things seriously, things that are already been used as well, like that, in more seriously in mental health care, would be, of course, a benefit in a population that doesn't have great outcomes at the moment. It's not like we feel like we're doing everything right and everyone with mental illness who receives care and medications gets better. It's like this is an area that needs improvement. So let's start looking at novel ways to improve outcomes.
Yeah. I mean, that's such a brilliant overview of a sort of the state of the science of nutritional supplements, where they sit and how to contextualize them too, I think. And like as I'm hearing you speak, one of the things that really stands out is that it's almost like we need to look at these really differently to medications. There needs to be more nuanced understanding, personalization, and acceptance of the limitations in the type of evidence that we can provide for these kinds of interventions. It's
Yeah. Yeah, and
something
we'd
in
also
that.
need to look at medications differently, really, as well. Medications you're looking at the
Yeah.
same in the same way in terms of which one will work for which person, not which one will work for which diagnosis. Because the
Yeah.
fact is, there's not really that much underlying as a common construct of any of those diagnoses. Two people with the same diagnosis of schizophrenia might have completely different symptoms, in the way it manifests, completely different outcomes, completely different responses to the same medications. And it's because these are useful constructs clinically, but it's not underpinned necessarily by any biological reality that's the same across every individual. So then, in the same way, we can't expect treatments to work across any individual. It's not like having an infection and the antibiotic will work basically 100% of the time for that particular infection. It's a complete opposite. So yeah,
Yeah.
revamping the way we look at individualized medicine is going to improve everything from lifestyle interventions, nutritional interventions, and even pharmacological interventions for mental health.
Yeah, it's really well put. And, it's a good thing to reinforce is that, that personalization is not unique to nutrition. It needs to happen with everything. Yeah.
Yeah, yeah, yeah.
Yeah. So moving on from nutrition, an area of focus for you, and this is well out of my depth, I have to say. So I'm gonna lean on you for this. But you're really deep into digital technology, looking at how the digital environment influences mental health, and importantly, how to flip that and how it could be used to deliver and scale interventions to reach more people. So, yeah, I'm really curious to understand a few things around this. Firstly, probably the question on most people's minds is like, is the internet bad for me? Is sort of the standard thing you hear a lot is like social media rotting our brains. And I know you've spent a bit of time looking at the digital environment and how it interacts with cognition and mood and so forth. Can you give us a top line view of how the digital environment is impacting with mental health?
Yeah, absolutely. That's been one of my biggest interests over the last 4 or 5 years, more emergently. As kind of like a lifestyle factor, it's like this new lifestyle factor that's just a necessity in all of our lives.
Yeah.
Spend significant amount of time every single day looking at a screen on a phone or on a computer or whatever it might be, and activating ourselves in the online world is such a new thing and such a central thing of our societies. It's really interesting now how is that lifestyle factor impacting on people, and it's for a long time been looked upon as like the amount of screen time just in minutes per day and how that impacts on health. So that's kind of like taking it like a factor like sedentary behavior or like exercise and saying what amount of this thing is good or bad for an individual. Whereas actually the online world, the more we get gathering the data and the more we're doing the studies on it, it's more of a lifestyle factor like diet, where it's not just about how much somebody's eating or whatever. It's about like what are the individual components of what somebody's eating, what are you consuming in the online world, and how you're engaging in the online world is ultimately what's going to be driving your mental health outcomes in particular of online engagement. So there's a number of ways that seems to be, manifesting. One of the most obvious ways is social media. And, we see whereas some people who have like a positive relationship with social media get a lot from it, especially older groups who might have become socially disconnected from either their usual friendship groups, managing to keep them alive through social media, or even forming new friendships and addressing things like feelings of loneliness. Seems to have tremendous potential in that area for sustaining mental health. But then on the flip side, you get younger people whose whole social lives become just completely imbued in the online world in ways that can be quite negative, and things like cyberbullying, obviously, and other elements like that, actually having quite a disastrous impact. You hear some really sad stories about how this has, been a total crisis in some young people's lives, and then everything in between as well. So now's a real time to again start studying this and looking at what we're doing. So when you say is being online bad for me, I'd say being online in itself can be good or bad for you, depending on how you engage in the online world. Separately to that, being sat down for too long per day and the amount of time we all spend in front of our screens is definitely bad for us. Like there's
Yeah, yeah.
obviously we're all missing out on too much sunlight, and we're all being way too inactive. So there is that element that's almost definitely bad for us. Unfortunately, we have to admit that. But that obviously can be addressed by making sure we engage in physical activity, or for people wanting to look at how screen time might be influencing their kids' mental health and well-being. The first thing is probably make sure that it's not just detracting from all the other things
Mm,
that do impact on our mental health and well-being, like having a healthy social life outdoors and exercising and simple things like that. And then beyond that, it's like understanding the content. And there is more and more evidence as well about just consuming content in the online world through that like rapid fashion seems to be reducing people's attention span and the amount of time people spend attending to stuff, even on a population scale. There's studies that have, very cleverly like mapped the amount of time the human mind seems to be attending to a particular topic, and how quickly we're changing is happening faster and faster and faster. So our ability for sustained attention, be it as a population or as an individual, seems to be negatively impacted by, what some people call TikTok brain or whatever, but it could easily be from YouTube Shorts, or just even opening, lots of different internet windows and going from one stimulus to the next without really needing to spend any time on any individual thing seems to be detracting from some elements of attention. And that might become more pronounced in young people who are supposed to be developing those attentional capacities for the
mm.
first time. We'll feel it ourselves as probably, fully developed adults and notice some type of decrement over time, but especially in younger people, the effects might become more pronounced, and that's where the evidence is today, and potentially even brain changes with that. So what we're doing really is looking at how can we make the online world a healthier place as well, and how can we make it a place where it is actually useful for people to sustain mental health. And deliver lifestyle interventions and things like that. So one of the things that we're most excited about at the moment is our partnership with the guys at YouTube Health, who's been supporting us in setting up the first ever like YouTube-based lifestyle intervention for mental illness. So
Wow.
it's our eFit mental health channel, which you can see the demo version is actually live on normal YouTube right now. So this is about providing content in the online world, which then can be presented through, mental health services to provide evidence-based access to nutritional information specific to mental health and exercise, even home workouts and things like that, motivational stuff, stories about how people with mental illness have used these factors realistically in their own recovery. So we're looking at just ways of building that out so that the idea of lifestyle medicine for mental health and lifestyle psychiatry has that actual presence in the online world that can be provided through services, because we know people are already spending a lot of time on YouTube and things like that, in
Yeah.
some good ways, some in bad. So yeah, let's not shy away from the adoption of the online world. It's completely redundant now to say whether it's good or bad for us. It's happening, isn't it? Like nobody's going to spend their life offline. So let's
Yeah.
look at ways we can actually make it a healthier place for people or provide evidence-based interventions through that world.
No, that's really fascinating. What a great way to frame it too is like quality over quantity, basically. It's the same way we think about nutrition. It's not, necessarily the food is particularly bad for you. It's like
Yeah.
the overall picture and sort of navigating that digital world in the same way, looking for the stuff that's helpful and the stuff that isn't is really novel.
Yeah, I'd really like to develop that idea of like this digital diet. Let's have a look
Yeah.
at some, like, digital dietary guidelines and things like that of how much you should be consuming and try and get that sense of not because it should be taken seriously in terms of like minutes per day on each thing, but just to get that sense across society of it's like that sense of balance, like what we
Yeah.
understand about having a balanced diet, having a balanced online lifestyle is probably just as important as well.
Yeah, that'd be awesome. I mean, it's not been well contextualized. It just feels like the Wild West at the moment in terms of information around this for people.
Yeah. And it's changing so quickly as well, like with new online factors, right?
Yeah,
Recently, with the introduction of LLMs and chatbots, people are spending more time engaging with those. And then it introduces a whole different factor of, well, how does that impact on mental health and well-being and things like that? So,
yeah,
we're staying up to speed on it and we're trying, our own initiatives in that space as well. So it's an exciting area. Yeah, that again, ripe for adoption. Yeah.
yeah, absolutely. That's fascinating. And yep, in terms of like flipping the digital world to improve people's health, are there examples of digital interventions that have made significant positive health impacts on people? I know you're involved in a pretty recent review, 2025 Journal of Medical and Internet Research, I think, looking at online lifestyle-based interventions. What sort of things are you seeing out there?
Yeah, so that's quite a novel review actually, and a meta-analysis conducted by Jacinta Brinsley and her team in I think they're either in Adelaide or maybe are you from Adelaide? Maybe you're from Sydney, aren't
I
you? Yeah,
won't my neighbors know.
yeah, something like that. They're over there, and they're doing some great work, and we worked with them on a meta-analysis, putting together all the evidence around online lifestyle interventions. So things that have used digital tools to deliver things like exercise and nutritional interventions and the outcomes of that for mental health. And basically, the message of that review is as much as apps and all this stuff get a bad press in terms of making people more sedentary and making people less healthy, I guess there is a real potential for exercise interventions delivered via app and dietary interventions delivered via apps and sleep interventions all via apps to actually confer positive benefits not only for the health behavior, make people exercise more, make people help people to sleep better or whatever it might be, but also impact on mental health in a positive way. So reducing symptoms of depression and anxiety and things like that as a result of engaging in these online lifestyle interventions. That's something our group's taking forward a lot as well, as I kind of mentioned with the YouTube health stuff and some other initiatives. So it's like they can be effective tools for behavior change. And we know that our digital devices do change our behavior massively. So let's look at how we can use those in a way that changes our behavior for good rather than for bad.
Yeah, absolutely. Yeah. No, that's brilliant. Thanks for that. And I guess like as we get to closing this out, I wanted to ask you some bigger picture questions. Like you've been involved in pretty high level, publications and influence globally through different associations looking at this. And I think for people out there in practice, it still feels like there's limited adoption of lifestyle medicine in psychiatry and for mental health, both at a public health level, but also in a clinical one-to-one or multidisciplinary type setting. You know, what's the good news? Like you've been in this for a while. What are you seeing that's positive that's coming out of all this work and influence?
Yeah, I think I agree entirely with what you're saying. And people who are passionate about these approaches often do feel like it's a massive uphill battle to get them used widely in mental health care services. And certainly it is. But the good news is that the evidence is increasing, which is one thing. So the actual empirical research is increasing. And that is now reflected in a whole number of really credible guidelines from different, health kind of societies and then also national and international guidelines and things like that. It really is getting its uptake in writing at the moment. So we still need that translational step to actually commission it to happen in the services. And part of that is finding feasible ways to implement it. But for people who are already out there passionate about introducing these interventions in an evidence-based way and getting the backing for that clinically, I'd say the guidelines will probably be out there already, and the evidence supporting what you're wanting to do, if you're wanting to do something that is evidence based, will be there already. So,
Yeah.
just even in the last few years, we've put together stuff with the EPA, the European Psychiatric Association, on exercise guidelines for mental health, lifestyle interventions for mental health. There's the WFSPB, which is the World Federation for the Society of Biological Psychiatry. Their guidelines on nutritional supplements and herbal supplements that puts together a really good evidence based around those things for people interested in that, specifically for a whole range of different mental health conditions, across major depression, across anxiety disorders, whatever group you're working with, schizophrenia even. So, there's the stuff from the World Health Organization, which is the more general global guidelines on physical activity and sedentary behavior, the ones that I were involved in, now give really strong recommendations based on really strong evidence around physical activity, just as much as we know it to be important for cardiovascular health, it's important for mental health as well, So it is part of these national, international guidelines from these really well recognized health bodies in ways that we've seen a lot of people manage to leverage into producing clinical changes. So I guess you're not on your own anymore, and you don't just have to sound like, a man shouting in the wilderness for trying to get these initiatives actually going, because we do have the guidelines. And then with the other thing, it's like, let's look at ways to bridge those guidelines into a more, compulsory setting for mental health care services to take on. That's where it requires the commissioning, that's where it requires the funding, and that's where it requires the novel platforms of interventions like the online world. And we're working a lot around that. So producing online resources for people to implement that evidence. And even the communities are great as well. So for people out there who are interested in implementing these approaches, see what your local communities. Local communities are often doing a lot better than mental health care services. Not because I'm criticizing mental health care. They're the most under-resourced, and underfunded and overstretched services that we have in healthcare. So they're just kind of like in crisis mode a lot of the time, and that's all they can do. But then the community leisure services and the council run stuff often do have walking groups for mental health, sports groups for people with mental illness, sometimes even exercise referral schemes that aren't really capitalized on by mental health care. So if you connect with them, if you're a mental health care provider, you can find a lot of options that wouldn't otherwise be available with funding behind them already. That kind of, there's a separation there at the moment. So that's just an extra tip. Or, look to the
That's
guideline, look
that's
elsewhere.
really good insight, I think. And for listeners who are, feeling frustrated and want to make a difference, I think knowing that, the evidence is there to back up that now, and knowing that there are, it's probably not grassroots, but knowing there are things outside the healthcare system like community groups, council groups, local support groups, that sort of thing, where you can jump in, be part of it, and make changes is
We've
really,
seen a lot of success from stuff like that and been involved with a lot of the establishment with it in Australia and in the UK. And the same with the guidelines. We kind of know what's around, but only because we've been involved in producing it, it can be quite hard to navigate. So I'll do an exclusive offer for the listeners of the podcast. If you've managed to bear with us this far, or members of NMI, if you do want guidelines to inform what you're trying to do, get in touch with me by email and I'll send you the correct guidelines most relevant to what you're interested in doing. If you don't know where to find them, from the most recent stuff, and or tell you about what we've been doing. If we've got some most recent stuff happening outside of those guidelines or on top of that, I'll tell you about that as well.
yeah, that's brilliant. And we can also post people to links and resources in the notes as well. So
Yeah,
off,
great. Yeah,
well,
yeah. There's a whole bunch of stuff we could add there.
yeah, we'll do that, and people can jump in and look at those. So, hugely optimistic, I think, like in a relatively short time, this field is progressing at leaps and bounds, and it feels a bit like we're at the crest of a wave that, if that implementation comes through from that evidence and from that adoption within policy, we should see a real step change in mental health care.
Yeah, I think so, and that's what we're going towards. We've only just last month released our most recent update of the Lancet Commission on implementing lifestyle interventions in mental health care. So that's been a huge initiative, undergoing, a lot of work for the last couple of years, piecing together all the evidence and producing really strong practical guidelines and recommendations, along with a number of examples that have been really useful to the people who've read it so far in terms of examples of real world clinical services that have managed to implement these approaches in
Mm.
evidence-based ways, within the confines of regular care. So, showing it can happen for people who might feel it's, a step too far. And it can be in some circumstances. That's not to put the onus on every individual, but yeah, it's there's a lot of good examples of how we can do it at different levels as well. So yeah, we'll put that in the notes.
Yeah, yeah, no, that's brilliant. And just to close out, thanks for your time. Like I know how busy you are, but I really appreciate you sharing your experience and perspective with listeners. It's been hugely optimistic and nice to know, how quickly this field's progressing in a positive way. It's really
No, thanks for
inspiring.
your time and thanks for your effort in, giving this type of work a platform as well. It's really appreciated. And I find these conversations, you can probably tell, very exciting, compared to the usual screen time, I'd say. It's been a great chat and it's great to get these messages across to a different audience. And yeah, I hope we get a chance to do it again in future.
Yeah, brilliant. Thanks again, Joe.
Okay, thank you.